The next bill on the calendar for the day is Senate File 1770. The clerk will report the bill.
Senate File 1770, the third engrossment, an act relating to data practices.
Representative Lesch, and there is a DE amendment. You want to get that in front of us? There's an amendment at the desk. The clerk will report the amendment.
Lesch moving to amend Senate File 1770, the third engrossment as follows. Delete everything after the enacting clause and insert the language of House File 2167, the first engrossment. The amendment is coded DEA 2167.
Representative Lesch.
Thank you, Mr. Speaker. Members, please support this amendment. This inserts the House language and ensures that we're considering the language that has been through committee and is properly on the House floor. So please vote yes.
All those in favor say aye. Aye. All opposed, no. Motion prevails. Representative Lesch.
Thank you, Mr. Speaker. Members, citizen distrust of government feeds on government secrets. What government is doing, whom it is colluding with, whom is getting paid, and how much they're getting paid. Follow the money, that iconic phrase introduced to us by a government whistleblower in the Watergate scandal, was quickly met with its logical conclusory query: how much did they know and when did they know it? And that's the subject, essentially, of this bill. These scandals gave rise to multiple sunshine laws and open government practices in their ensuing decades. And one of these laws was enshrined in Chapter 13, the Minnesota Government Data Practices Act. In 1999, current law was amended in Minnesota Statute 1305, Subdivision 11, to require that a government entity that contracts with a private person to include a provision in the contract that all of the data related to performing any of its governmental functions are subject to the Data Practices Act, just like if government was doing it itself. And they must comply as if they were a government entity. In 2013, on November 21st, the Minnesota Supreme Court in Helmberger v. Johnson Controls determined that if the provision required by 1305 Subdivision 11 was not included in the contract, its existence cannot be inferred in the contract. This holding is a departure from how we had always expected Chapter 13 would operate. It also is a departure from the way the District Court and the Court of Appeals anticipated that Chapter 13 would operate. Therefore, this bill, members, this bill does not change current law requiring the provision in contracts between government entities and private persons. The only change to the bill makes to current law that is if the legally required provision is not included in the contract, it will be inferred as part of the contractual terms. Minnesota agencies are currently, based upon the case, the Johnson Controls case, they are writing this into future contracts. However, there are existing contracts with which we must still deal, and also there are local units of government, members, that we need to ensure that this government information is in fact public information, including contracts written by school districts, municipalities, mosquito control districts, counties, and the like. So with that, members, that's essentially the bill. I understand it gets a little bit more complicated than that, and there are some amendments.
There is an amendment at the desk. The clerk will report the amendment.
Hortman moving to amend Senate File 1770, third engrossment as amended as follows. The amendment is coded A1.
Representative Hortman.
Thank you, Mr. Speaker and members. And I'm a co-author of the Lesch bill because there was a decision in the Timberjay case, and we did want to correct that in some respects so that the public can find out information about subcontracts, particularly in the construction situation that occurred in that case, where a school district contracted for the construction of a school, and the people in the community are entitled to know what the subcontracts were. However, when Representative Lesch and I and others dropped this bill into the hopper, we did not realize that as to health care data, we would be opening Pandora's box. And the complications that would arise in disclosing all of this healthcare data in the subcontracts did not become evident until later this session. And so what the A1 amendment would do is it would say, let's take a breath, let's take a pause with regard to the healthcare data and give us a year to come back and work on it make absolutely clear which information the state of Minnesota should have publicly released about those healthcare contracts, and which of the data is better in the public interest to not be made public. So what the A1 amendment does is it does not apply the new law that Representative Lesch is proposing to the healthcare plans until 1 year from now, so that we have a chance to do this right and look at all the unforeseen possibilities that we didn't think about when we dropped the bill in. So members, I'd ask for your support on the A1.
There is an amendment to the amendment. The clerk will report that amendment.
Bly moving to amend the Hortman amendment to Senate File 1770, the third engrossment as amended as follows. The amendment is coded A5.
Representative Bly.
Thank you, Speaker. When I read the amendment, the A1 amendment, I was concerned that offering an exemption to get to the study for the plans to abide by this requirement concerned me. And so rather than having an exemption, what my amendment to the amendment does is to delay the effectiveness of this provision so that the healthcare study can go forward, and then we can determine whether or not they should abide by this law. Just a little background on why I'm concerned about this. The state of Minnesota used to manage its own plans, and then in the early 80s, HMOs actually were invented in Minnesota, and we were persuaded to give them a try at managing our public health plans for the poor, and the idea being that it would save us some money. And skeptics who were uncertain about whether or not the HMOs would actually save us money asked for a study. And unfortunately, that study telling us about whether or not the HMOs have saved us money was never done. We don't know. This became a concern of mine when some years ago the hospitals came to the legislature indicating that they felt they were not getting enough reimbursement from the HMOs for the patients that they were seeing who are on our public plans for the poor. And so they asked for an increase in the allocation that would go for their reimbursements, and Senator Berglund gave them that. A few years later, they came back to the legislature and said, we're not seeing any of that increase. It's not coming to us. So the question is, where is the money going? I don't mean to cast aspersions or suggest anything, but I thought, well, let's find out. Let's ask. Who's evaluating this? Who's looking at this issue? Turns out that there's an auditor in the Department of Commerce who looks at the plans and determines whether or not they're being fair with their reimbursements and all of that. And I called him into my office, asked him, how do you assess whether or not they're using the money we give them wisely? And he said something which surprised me, and that is that there's no way that he can determine that because the information is proprietary, and therefore he has to go by what the HMOs tell him they do. So for me, it's important that we know, and I understand there may be information that perhaps shouldn't be public, but I think taxpayers have a right to know how their money is being spent, and I think we should know whether or not only are they saving us money, if they are, but where that money is going. Is it getting to the healthcare institutions that it should go to, and how is that working? So I think the study is incredibly important, but in fairness to the plans, I'm willing to give them a little time to let us know that. Thank you.
Representative Petersburg.
Thank you, Mr. Speaker. And if I could ask, is Representative Hortman the original author of the original bill? I mean, of this amendment?
She is of the amendment, yes. Representative Hortman will yield. Representative Petersburg.
Representative Hortman, and maybe you're not the right person to ask this question, but I'm very much aware that HIPAA, the Health Insurance Portability Act, through the federal government, is very restrictive in data privacy and so forth. How would this impact, or even this bill impact that part of it, and whether or not that actually supersedes what we're trying to do here?
Representative Hortman.
Thank you, Mr. Speaker. And Representative Petersburg, that's a really good question. There's other state law and federal law that protects patient data. So regardless of whether Representative Lesch's bill passes with no amendments or whether my amendment is added, patient data is protected private information. The data that we would be opening up if we pass the Lesch bill without my amendment is information on provider agreements and certain details that aren't necessarily things that we intend to be public.
Representative Petersburg.
Thank you, Mr. Speaker. So it appears to me then what we're really talking about is just provider information and not necessarily about any individuals. So thank you for the clarification.
Representative Huntley.
Mr. Speaker and members, I have handed out a number of papers. The first one, your copy is white and black, says that the Minnesota Hospital Association and the Minnesota Council of Health Plans is opposed to the original Lesch bill and would support either the Bly amendment to the amendment or Hortman's original amendment. And let me give you a little bit of explanation why I think we need one of these two amendments. This just came out last week. It's Health Affairs. Basically the whole issue is devoted to what is their headline here, and it says U.S. hospitals responding to an uncertain environment. So they don't know what's going to happen. And then I've handed out a summary of this article, which is from the Congressional Research Office. And what they say is that hospitals and healthcare costs are different than the rest of the economy. And the last thing I want to say is this. I handed this out. It's an article from the New England Journal of Medicine by a guy named David Cutler, who is at Harvard and is probably the foremost healthcare economist in the country. And let me read a couple things from that article. He says, applying the Sunshine Rule in the provider-payer context, however, could give the opposite of the intended effect. It could actually raise prices charged to patients. He goes on to say the Sunshine policy would create a perverse incentive for hospitals to raise prices on average, and as a result, its rivals could do the same. And the last section is on the second page. And remember, this is a very top-notch economist, says, but complete transparency of prices negotiated between payers and providers would raise costs instead of lowering them, especially in the markets where there is some degree of pricing power and where consumers are imperfect decision makers. As in so much of medical care, the best intentions can go awry if the plan is not thought through and correctly executed. That's from the New England Journal of Medicine. So members, what either one of these amendments does is ask us to spend a year studying this issue and making sure that what we do is good for the state and reduces health care costs and does not raise them. So I urge you to vote for either one of these, either the amendment or the amendment.
Representative Hortman.
Thank you, Mr. Speaker. Thank you, Representative Bly, for your amendment to the amendment. I think that Representative Bly takes a very thoughtful approach. It's a measured way to deal with the problem. It presents an elegant compromise, and I think that the Bly amendment plus my language improves the Lesch bill. So I'd encourage you to support the Bly amendment to the amendment.
Any further Representative Holbrook.
Thank you, Mr. Speaker and members, and I agree that the Bly amendment is a good idea, but I did want to at least briefly touch on some of the comments made by Chair Huntley. I think that the reality is that we just don't know all of the ramifications of this, and when the health plans come to you and say that if the Lesch bill passes without these amendments, that all of our contract information is going to become public, I don't think that's a fair characterization. Chapter 13 allows for information to be held related to trade secret data, etc. And so it's not as simple as the health plans may have lobbied you on. But that being said, there's certainly a lot of concern, and I think taking some additional time to take a look at this issue is a good idea. I just don't like the approach that we're carving it out for just one industry. We don't make good policy when we do that. We should always try and look at legislation that works across the spectrum of government functions. But I think we're at the end of session in a tough spot, and this may be our only option for today.
Representative Bly.
Thank you, Speaker. I'd ask for a roll call on.
Roll call being requested. Seeing 15 hands, there will be a roll call. Representative Lesch.
Thank you, Mr. Speaker. Would Representative Hortman yield to a question?
She will. Representative Lesch.
Thank you, Mr. Speaker. Mr. Speaker, Representative Hortman, if this amendment were to go on, your amendment, and your amendment passes, then if I was a health plan, could I enter into as many contracts as I wanted over the course of the next year in the hopes that there would be an extended contract period, thereby avoiding the sunshine aspects of the law and continue to keep my contracts private?
Representative Hortman.
Thank you, Mr. Speaker. Representative Lesch. No, I think if the Bly amendment goes on to my amendment and my amendment goes on to your bill and that becomes law, what it says is that on June, I think it's 30th, 2015, that data is available to the public. And so unless we were to change state law in between now and then, I don't think the entering into contracts would not affect the effective date. The law would become the law on the date when we say it's effective, regardless of what the contracts say.
Okay.
Representative
Mr. Speaker, Representative Hortman, with all due respect, I don't think you're correct on that. Because for one thing, the law is not explicit. And members, this is one of the problems with trying to craft huge implications of law for secret data on the House floor. I'm really not certain that we should be doing this. The basic bill, Helmuth versus Johnson Controls, was a bill that addressed the question in the lawsuit and the decision that was completed and handed down on November 21st. Trying to do this right now, nobody really knows. And when we say we write it into law, we're pretty much sure. If it's squishy, we know just by the Helmuth v. Johnson Controls case itself that the Supreme Court, given any wiggle room and any squishiness, kind of crafts into the law what they want to anyway. So I am not satisfied at all with the decision made on this floor if the Bly amendment went on, that in fact your constituents would know how their taxpayer dollars are being spent. So I take no position on the Bly amendment, but regardless, the Hortman amendment, primary amendment, should probably be voted down, but I'll speak on that when it comes up, Mr. Speaker.
Okay. Representative Abler.
Thank you, Mr. Speaker and members, and I'd like to speak in favor of whichever version goes forward. I guess people are comfortable with the Bly language, which looks like identical to me to the Hortman language, which just says it a different way. But I think the reason I'm going to vote yes on this amendment to the amendment and on the amendment as amended is that you don't want to cause unintended consequences. And in the world of health provision, a lot of us have always wanted to know what people get paid in our line of work, what the competition has been, or how the contracts have gone, and that's been a debate for a long time, and maybe it makes sense. But as the now health policy maker, I want to keep costs as low as they can, and I don't want to give other groups a chance to get a higher reimbursement than they otherwise might. That would be the effect of this potentially as well. And so, as we know, there are regions of the state that get paid more than other regions of the state. The Southwest gets paid more than the North Metro. And so, if that were known, that would be interesting, but there might be a fiscal note to that as well. And so, as Representative Lesch has said, I actually agree with him. You don't want to do things on the fly that cause harm. And this bill going forward, as introduced without the amendment, I think could cause significant harm. And so I think slowing it down for a year is prudent so it can be properly dealt with, and I urge members to vote yes and yes. Thank you, Mr. Speaker.
Representative Loeffler.
Thank you, Mr. Speaker and members. Since the issue of what the impact of this might be on cost has come up, and I really do think that's something that perhaps has been exaggerated. But if we had transparency, and I have always trusted Representative Huntley when he brings research data forward, but the article he shared is from 2007, before we got into a lot of HSA and consumer directed plans and a lot of other things that have really changed our market in a lot of different ways. But we're talking about managed care. And the transparency will be actually also between plans. And if Health Plan A pays $100 for a particular procedure and Health Plan B pays $110, I kind of think, you know what, it might go to $100. Because when I've talked to healthcare providers and others, they don't feel empowered in that negotiation. That they feel like because of to maintain their patient base, they need to sign the contract with the health plan because it is the health plan that brings the patients to them. And so they don't feel like they have any leverage, and it's take it or leave it. And that the real impact of this, I think, on the economics is actually going to be about transparency between the health plans if we got to that. But I do think we also need to realize that we are authorizing a rebidding of these contracts, these very contracts we're discussing, with an RFP that will be coming out on January 5th of this coming year. And that is the context in which we're debating this. It's not like we have continuing contracts and we'll get this all resolved with this delay before we go back into rebidding. We are going to rebid those contracts with an RFP that will go out in January. And so that changes the context, I think, of this let's study and delay it. And so I have great hesitancy about us moving forward with this exception.
Representative Quam.
Thank you, Mr. Speaker. And one thing you got to keep in mind that even though we're talking procedures, it's also the individuals, the doctors, the facilities, and you do not have the exact same results, recuperation, etc. I mean, there's a reason why you work through and you get a preferential group of providers or clinics, and why I receive many phone calls and emails from constituents that with the changes in turmoil, and they've been put onto MA for Minnesota Care, now they do not have access to 2-3 doctors that they've seen before. They still have access to the procedures, but they don't have access to those doctors that they prefer and have a relationship to. And frankly, not every doctor may be the same value for that procedure. I know when you look at, the easiest ones, look at pro sports. The ones that are the best at certain procedures for, knees, ankles, elbows, etc., that they do the same procedure, but the recuperation is 20% quicker. Well, I mean, that's real, but you can't quantify that easily. So there is a little bit of more than, well, this procedure, that procedure. It is important that you be able to choose your doctors, your networks, and that process is a little bit behind the scenes, but that's part of the competition, the activity that I think that has provided us a pretty good healthcare system in this state. Now, I wish that we did have transparency, that we knew in September what the new rates might be, but this body has voted against that transparency and letting people know farther ahead of time. So I have the same concerns about we need to have transparency, but I have concerns about what are the impacts if it's totally out there. You don't have the creativity, the networks, etc., that have given us, I think, a better quality plan. We're not going to find out what the costs are going to be until late next year, because we voted against that transparency to let the people know. So I would prefer, I guess, the original amendment unamended because of possible future ramifications. So I'm against the amendment to the amendment, but I can support the amendment.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. Zellers votes aye. There being 117 ayes and 14 nays, the motion prevails. The amendment is adopted. There's another amendment at the desk, the amendment to the amendment. The clerk will report the amendment.
Liebling moving to amend the Hortman Amendment to Senate File 1770 as follows. The amendment is coded 1318.
Representative Liebling.
Mr. Speaker and members, I know that this discussion is very difficult for those of you who who are not on the Health and Human Service committees. This is a very complicated discussion, but I want to make it a little simpler for you. So what we're talking about is our public health care programs. Money that is taxpayer money that's used to pay to provide health care for low-income Minnesotans. If we manage that program ourselves through the state, because it's a government program, Minnesotans, the public, would be able to find out how that money is used. Minnesotans would be able to find out how much we're paying to various providers to make sure that our money was going to the right places, that it was being spent correctly. And understand, this is about the second biggest budget item in our state. So I think, I've been trying to find the correct number, but I believe it's around $8 billion, billion with a B, $8 billion every year. That's a lot of money. If we were running the program ourselves, people would know where the money was going. But because we don't run much of this ourselves, we contract with private entities, the HMOs, to run the program for us. We don't have that information, and the public can't get the information. Now, the specter's been raised here of how this is going to raise costs if we don't let these organizations keep this data private. There is one place in the state that we have an example of what will happen if we let it be public, and that is with our county-based purchasing organizations. Many members on this floor represent county-based purchasing organizations. They are public entities. All of their data is public data. And their costs are not higher. They have done very, very well. And so if you're worried about this issue of, the world will come to an end, costs will go up if we let people see what we're spending, you can see right here that that is not the case. Now, Representative Grunhagen asked earlier in the session, had an amendment, and he brought it up several times to get rid of Rule 101, which, as it impacted dentists in rural Minnesota. And I hope Representative Grunhagen is listening. The problem we have with dental access is that rates to dentists for our low-income patients are very low. We hear this constantly, and many dentists won't take patients because the rates are low. This is a problem we all know. So if you want to find out how much the HMOs are paying to the dentists, that would seem like a reasonable question, wouldn't it? How much are they getting, in fact, to take care of our patients? Well, guess what? They won't tell you, and you can't get the information. So I and Representative Grunhagen, as we attempt to deal with this issue, we are unable to get information that we need, critical information about where our taxpayer dollars are being spent to buy health care for Minnesota's patients. And we can't get that information. And now here we are, and these organizations are asking for an exemption from what we now understand the law to be, and they're saying, give us more time to not give you the information. Well, these public entities, the county-based purchasing organizations, have been transparent with theirs, and guess what? Dental rates have gone up under these organizations, and for the county-based purchasing plans, as far as I'm aware, access to dentists has been very good. Much, much better than under the HMOs. So members, if you want to improve health care and you want to meet your responsibility as a legislator to be able to manage and know where health care dollars are going for our public patients, our taxpayer dollars spent on patients for whom we are providing the care, then my amendment should be just for you. And you can probably gather from what I'm saying that I oppose the Hortman amendment. But at the very least, we need this amendment to the amendment, because all this says is that we who are supposed to set policy, we who are responsible for our taxpayer dollars, $8 billion of them a year, $8 billion, and we don't know where that money is going. We don't know who is getting what out of those dollars. And when we've asked for it over the years, the legislators who sit on the Health and Human Service committees, we've been told, we can't tell you, we won't tell you, that's proprietary. And now we know that isn't true, and now we know they want another year to figure out, I suppose, whether to give us the information or how to avoid giving it to us. Because the world is not going to come to an end if we, the legislators, know where the money is going. And so that's what this amendment is doing. It's saying we who are sitting here on this floor voting on this, we have the responsibility and should have the ability to get the information. Now, I know I'm talking a long time on this, but I want to refer to one more thing before we vote, and that is the Siegel report. Now, I know many of you don't work on HHS, don't know what that is, but about a year ago, the state contracted with the Siegel company to do an audit of our healthcare programs that we've been discussing. And one of the things that the Siegel report was very clear that for years past, we have been overpaying compared to other states. Overpaying. And one of the problems that they pointed to was a lack of paid claims data. In other words, we have not had access to data about what we've been paying for health care for our public patients. And you can see that this has at least there's a correlation, right? We haven't been getting the data, and our costs, what we've been paying through the HMOs, has been very high. And this is not just me saying it. This is an objective audit that was done by the Siegel Company, which you can get access to. So we on HHS have been fighting this for years. We've been asking for this information. We've been told repeatedly we can't get it. Here is our opportunity to say that is wrong. At the very least, we legislators have to be able to know what we're spending. So I urge your support, and I would ask for a roll call.
Roll call being requested. Seeing 15 hands, there will be a roll call. Representative Hortman.
Thank you, Mr. Speaker and members. I oppose the Liebling amendment. It deletes the section of my amendment that puts the pause in place, the one-year pause that Representative Holberg spoke positively about, Representative Abler spoke positively about, and that Representative Bly amended to a more elegant solution than what I had proposed. So, members, what the Liebling amendment does is basically delete the part of the Hortman amendment that we've been talking about. Could give us a chance to do this right and look carefully at what information should we release and what information should be kept private. In addition, the Liebling amendment gives legislators access to information that nobody else does. It puts us in a special category and gives us access to information that we say is not public to anybody else. And I don't think that we should put ourselves in that special category. So please vote no on the Liebling amendment.
Representative Lesch.
Thank you, Mr. Speaker. Would Representative Liebling yield to a question?
She will. Representative Lesch.
Thank you, Mr. Speaker. Representative Liebling, would you ever pay $435 for a hammer?
Representative Liebling.
Mr. Speaker, Representative Lesch, it better be a mighty special hammer.
Mr. Speaker, would Representative Liebling yield to another question?
She will. Representative Lesch.
Thank you, Mr. Speaker. Representative Liebling, would you ever pay $600 for a toilet seat?
Representative Liebling.
Thank you, Mr. Speaker. Well, I certainly hope not, Representative Lesch.
Representative Lesch.
Thank you, Mr. Speaker. Members, those questions aren't just cryptic. I remember in 1986, I wasn't doing a lot in 1986. I wasn't paying attention to data practices and what kind of secret information the government was doing. But there was a commission that was doing it, Representative Zellers, and it was called the Packard Commission. And the Packard Commission lamented all kinds of secret sweetheart deals that were going on with government contracting, especially with military contracting. Some of the outstanding elements were that the Pentagon had paid $435 for a hammer and $600 for a toilet seat. Now, the public was outraged at this, and why in the world would we allow for such government waste? Well, the reason we allowed for it is because the public didn't know. That's how the government got away with wasting taxpayer dollars, is because they kept it a secret from the taxpayers. And when the Packard Commission did all of its work, they uncovered some of this, as well as many other, I guess I would say, wasteful spending that turned things around, not just in the Pentagon, but with respect to other government contracting. And so you, as members of the House of Representatives, are accountable for that spending. For the state of Minnesota, Congress was accountable for it at the federal level. Allegedly, the Pentagon was, and other government agencies were as well. But the buck stops with you for state contracting. And you're accountable for it the entire 2-year term. But you are reviewed for it this summer, leading up to the election. And during that job review, when your constituents come up to you and ask, wow, why are we expending these outrageous sums with respect to health plans, or anything else for that matter, but with respect to this amendment for health plans, what are you going to tell them? Are you going to tell them, well, they came and told us that they were really working hard to do the right thing, and they seemed honest to me, so I took their word for it? Is that going to be good enough for your constituents? I know it would not be good enough for mine. I know they would say, well, did you look at the spending? Did you look at what it was being spent on? How are you accountable for that if you don't even know? And so what Representative Liebling's amendment does, it says, okay, even if the public can't know, at least you'll know. At least as a representative of the people, at least you'll know, and you can tell your constituent, here's the deal, I can't tell you how the money was spent, but I looked at it and, trust me for now, which in a pinch may work. Honestly, I think that may have to work for now, and it may be. I'm going to support Representative Liebling's amendment. I still think that the public should know. I think in the long run, the public should know what we're doing up here. And the hallmark of that case, Helmuth v. Johnson Controls, was not legislators looking into the provisions of the contract for that school in northern Minnesota. It was gumshoe reporters from the Ely Timber J. And that's how we get some of our best information. I got some of the best information in 12 years from gumshoe reporters who were snooping around trying to find out what really was going on. Because at this part of the session, when we are awash in all kinds of information, we can be deluged with it and the wool can be pulled over our eyes. But not some of these gumshoe reporters. Now, this amendment would not allow for those gumshoe reporters to do their effective work. But it would put the accountability directly on us. So if in fact that's the case, and if in fact the health plans are nervous that they don't want this information to come out, I could say at the same time, if they're nervous that their practices are going to come out, you as legislators should also be nervous that that the public's going to find out you're spending $600 on a toilet seat or $435 on a hammer or God knows what else for taxpayer dollars. So the threats are equal on both sides. That said, I think Representative Liebling's amendment to the amendment is probably a good compromise. I'd ask you to vote green.
Representative Quam. Oh, excuse me, Representative Albright was up first. Albright, yes.
Thank you, Mr. Speaker. Well, Representative Lesch, I think one of the conundrums that you've placed before the body is that we're comparing an apple and a pear when you're dealing with a military project with cost plus build programs and mil spec and change orders that go on and whatnot to a competitive bid project that is, as you said, comes up for bid on a regular basis for health care. We're not building a new F-35. What we are doing is trying to deliver health care that is known and on a competitive business bid. And one of the things that I would urge the members to do is this is a competitive bid process. It's a sealed bid program that comes up based upon the RFP that Representative Loeffler comes out with. And that's what is the mystery. You don't give away your grandma's recipe for, chocolate cake because you don't want anyone else to know how it's made because that's why people like it so much. And the same thing is true about health care, dare I say, a much more complicated way, but you don't want to reveal the secret sauce because that's your competitive advantage in the marketplace. And that's what drives costs down. It affords people to not know what the secret sauce is from provider to provider, and it encourages them to try and figure out a better one for themselves. So I urge a no vote against the Liebling amendment.
Representative Quam.
Thank you, Mr. Speaker. And hammers, toilet seats, we're talking people. And frankly, I could support an amendment like Representative Liebling's amendment if it allowed for aggregating, allowed for a mean and a range, because I know of some cases where there was a pediatric case with complications where the bill was huge for a procedure. And I from conversations, same procedure, no complications, the bill was more than an order of magnitude smaller. So frankly, when you're talking individuals, you're not talking about a ball peen hammer. You're talking about an individual, and not everybody's the same. Some people have more than one condition, and when you try to make it a apples, 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 even if it's the same procedure, that's not really going to the solution. But if we look at the aggregated, look at the high, the low, and have that information, I think we can make some useful general policy considerations, make intelligent considerations. So I like the intent of gaining information. I like to have it somewhat in a summarized statistical form because the anecdotal is too variable for us to make policy off of. And frankly, when you look at this data with the third-party providers, contract, subcontract, you're stacked with so many tiers that it's not trivial of where the burden is percolated through the levels. You've got to define the different data sets and information. And again, we've had many discussions on the floor about just how complex this is. And I like the intent, but I think the solution in this amendment is not ripe enough in covering the complexity to be able to give us something that we can go forward with. So I applaud the thought, the effort, and I'll work hard to come up with a better solution for getting the data out, but I have to vote red on this amendment.
Representative Abler.
Thank you, Mr. Speaker and members. And Representative Liebling, I just want to help you out here. Friends don't let friends do crazy legislation on the floor, with all respect. You're a chairman. I've heard, I don't know how many times, there should have been a committee hearing on this. And Representative Lesch, this is your committee. We should have heard this in committee. You have no idea what this would do and what kind of problems this would cause. And, giving me all that data, that could just simply be dangerous, Representative Liebling. But, Mr. Speaker and members, to the whole topic of the amendment that the Hortman amendment is trying to address, we think it's important that we understand some of this data and information. We want to do it in a way that's going to be thoughtful and prudent and helpful to the healthcare industry in Minnesota. We have just sat through one of the biggest changes of healthcare in American history, and some of the health plans are still reeling from some of the effects of that. And so I don't think anybody can tell you the effect of this on the stability of our health system and how the plans might operate. And so if the amendment goes forward as Representative Hortman has put it in a year the whole thing expires and they get put under this oversight and scrutiny. That's a pretty good deal. But I also want to point out there's a whole department, a series of departments, whose job it is to oversee this information now. The Department of Human Services, Department of Commerce, in some cases Department of Health, are already supposed to be overseeing this, and they do. And we've done competitive bidding, and all this stuff is known internally at the department level. So members, you can do what you want on this amendment, but I think it's going to make it worse. And I don't know that you want to spend your summer chasing your own data, and that'd be just interesting. So I would suggest you vote no on the Liebling amendment with all respect, and then vote yes on the Hortman amendment and get this good information coming forward in a timely, prudent way. Thank you.
Representative Liebling.
Well, thank you, members. This has been a very interesting discussion. I'd like to just respond to a few points. First of all, to Representative Albright, Chapter 13 does have a protection for trade secrets, and so all of this information that meets that definition would still be protected. And the problem is they've always waved that around as a shield, and for far broader than it really applied to. To Representative Quam, this is not individual data on individual cases that we would have access to. I think Representative Hortman explained this very well. Other law completely protects individual patient data. So that is not what we're talking about here. So we wouldn't be comparing what was paid for one surgery with what would be paid for another. But the point is, members, if we don't have the data, we can't even ask the questions. So yeah, sometimes you get a data dump, like Medicare, if any of you pay attention to this, Medicare, the federal program, just released its data for the first time. And we were able to see where Medicare is spending its billions and billions of dollars. And it's a little strange. You can't draw a lot of conclusions just from what was released publicly, but it sure is interesting to see where the money is going, something we were never able to do before, and the world did not come to an end with that data release. But if there isn't any data at all available, you can't ask any questions. Now, Representative Abler's argument was really interesting because, as I understood it, at bottom, what he's arguing is The agencies of state government oversee it, and that's good enough. The agencies of state government, DHS mainly, oversee this, and that's good enough. Well, I don't know if you guys know that the feds are investigating what happened with our public programs over the last many years, and this is before the Dayton administration. But they are investigating what was going on, because you know half of our Medicaid is paid for by the federal government, CMS, Centers for Medicaid Services, Medicaid and Medicare Services. They have a great interest in this, and the state is being investigated. And all of us who've been here for a few years, we were here asking the questions, getting no answers. Well, who knows what was going on? And I guess we're going to find that out. But I don't want to be in that position again. I don't want to say it's good enough that some agency of government knows. I want to know. Another point, members, that the implication was made here, the suggestion was made that if we pass this amendment, we'd be flooded with data. That's not what this is doing. This isn't saying under law you must dump the data on us. This is just saying that we have the right to ask for it and that it's not shielded from us. I don't think that's a big data dump. Now, before we vote, I want to turn to Representative Hortman's objections to this, and I think her objections really amount to the fact that it's not drafted correctly, and that may be so. You know, the pre-file rule sometimes means that we can't do things exactly right. This bill will go to conference committee. Unless we adopt exactly what the Senate adopted, it will go to conference committee. And it can be fixed and it can be tweaked so that we're getting really the right language, and we could narrow it even further and just say the HHS committees should have, or even the chairs of the committees and the leads on the committees should have access. But if you vote no on this, you are saying that legislators should not be able to find out what we are spending in one of the biggest spending items that we have. I don't know how anybody can vote for that. So please vote yes on my amendment. Vote yes. If you think that it's your job to make sure that this money is spent correctly, then vote yes.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 39 ayes and 92 nays, the motion has not prevailed. The amendment is not adopted. We are now on the Hortman amendment. Any further discussion to the Hortman amendment as amended? Representative Hortman.
Mr. Speaker and members, this is the compromise that went on unanimously in the Senate. I think Representative Bly improved it. I think to address Representative Lesch's concern that he raised earlier, he wants June 30th to mean June 30th, 2015. We could certainly add some comfort language in conference committee, and I would encourage your support.
Representative Lesch.
Thank you, Mr. Speaker. Members, vote no on this amendment. If you vote yes, you are taking the risk that in this election year, a single item, a single kernel, a single nugget comes out about health care financing or contracting. And when that happens, it's on you. And I guarantee you that after the Timber J case came down on November 21st, these reporters are looking everywhere, because I have been contacted this legislative session multiple times by reporters looking for some opening of government corruption, of what's going on with how we spend our government taxpayer dollar on health care. So when a scandal erupts, be it small or big this summer, and it comes back that you voted green to mask this information from the public, I wouldn't want to be standing in your shoes. I recommend that the pause button for this bill is to say no to the to the Hortman amendment as amended, and ensure that next session we come back and thoroughly review what data sets the health plans want to keep secret, that we ask them for what reasons they want to keep this information secret about your taxpayer dollar, and that we come to a compromise at that point. But the solution is not to do it now. Not now when there's been no discussion. There was no discussion in the Senate before that went on in the Senate. I went and asked a couple senators afterwards, said, did you know what you're voting on? They said, no, the author just amended it. The author offered the amendment as some kind of compromise because they were getting a lot of heat and a lot of pressure from the health plans. But members, this is not a compromise. This amendment is not a compromise. Vote red on this amendment. Go to conference committee. We can have a discussion. Maybe then we can hear a little bit more about what kinds of information they want secret and for what reasons. But for now, I ask for a red vote on this amendment as amended. We can go to conference committee and see what we can do.
Representative Lane.
Thank you, Mr. Speaker. Well, Representative Liebling said if we managed it ourselves, and you have to remember, we used to manage the public health care programs ourselves. We'd know the information. We'd know the data. But we farmed it out for the purpose of saving money. And we don't know the data. We don't know if we're saving money. And I'll give you an example. Not too long ago, Representative Berglund in the Senate found out that a few years earlier she had said, the doctors are telling me they're not being paid enough. Here's more money for the doctors. It goes through the health plan, so she gives it to the health plans for the doctors. It took several years to come back that they never got it. Over all those years, they never got it. And we didn't even know because we don't have access to the data. And she was furious, and the health plan said, well, we had some extra expenses. We had to keep it ourselves. I gave it to you to give to them. And they didn't even know that we didn't even know that they didn't get it. So this is the problem we have. What we have here now is that on the one hand, maybe it's needed. Their own lawyers, the health plan's own lawyers, disagreed as to whether this was even important to them at first. They didn't even know if it was important. That's how important it is. It's not been discussed and justified. They have more lobbyists. We have more lobbyists in this area of government than anything else. They watch everything we do. And yet they come at the last minute saying, oh, maybe this is really a problem for us. The sky is going to fall if this happens this way. Well, I don't think so. You could say, well, maybe I can just trust them. Or, on the other hand, you could be rightfully concerned that your opponent would say you voted against accountability and transparency regarding $8 to $10 billion of public tax dollars, 35 to 40% of our state budget. You voted against accountability and transparency for that. When they can use the Minnesota Trade Secrets provision, which they already do. They have to request it and justify it to the Department of Human Services, and then they get it. They have it. So now we're going to give them carte blanche to an ambiguous concern, or we're going to vote for transparency and accountability of $8 to $10 billion of public tax dollars. I say vote against this.
Representative Hortman.
Mr. Speaker, I'd like a roll call.
Roll call being requested. Seeing 15 hands, there will be a roll call. Any further discussion on the Hortman amendment as amended? Seeing none, the clerk will take the roll. Members, please vote. The clerk will close the roll. being 70 ayes and 57 nays, the motion prevails. The amendment is adopted. Representative Murphy E.
Thank you, Mr. Speaker and members. I'm going to move a recess to the call of the chair. I would anticipate that we will be out for 30 minutes to an hour. DFL members will meet in our caucus room in 217 for a very brief time.
Representative Doubt.
Thank you, Mr. Speaker. Republican members will caucus upstairs in 316 right away.
All those in favor of the motion say aye. All opposed, no. Motion prevails. The House stands adjourned to the call of the chair. Or stands in recess to the call of the chair.